Hello everyone, my name is Lindsay Stevens, and today I'm going to be presenting on the effects of exercise on anxiety and depression. So, I'm sure that we have all heard the terms mental health and mental illness a lot, but what is the difference? So, mental health is described as someone's mental state and well being, whereas mental illness is a term that combines a wide range of conditions that affect someone's mental state and therefore their mood or behavior. As you can see on the left, there are many different conditions, including depression, which we will talk about today, along with anxiety. And then there are post traumatic stress disorders, phobias, shame, panic, stress. There really is a wide range of conditions. And there has been lots of research conducted on the effects of exercise on mental health in general. But today we're really going to focus on the effects of mental health on anxiety and depression. Anxiety and depression are the most frequently diagnosed diseases showing high comorbidity, which means they are often diagnosed concurrently or together. So, we're going to dive into the effect that exercise can have on both of them one at a time and then address them and compare and contrast at the end. So, what is anxiety? I'm sure as students, we have all experienced anxiety in one form or another, whether it's because we have a big test coming up, something stressing us out at work, or we have to make a big decision about our future and our major. This would be considered occasional anxiety because it's a temporary problem that causes us worry. This is different from an anxiety disorder. An anxiety disorder is not a temporary problem and it does not go away. In fact, it might get worse over time and it can interfere with the day to day life. There are many types of anxiety disorders, but today we're just going to look at a couple of them. First, we have generalized anxiety disorder, which is excessive worry on most days of the week for more than 6 months. This excessive worry affects the day to day life of the person that has it. Next, there is panic anxiety disorder. This entails a panic attack, which is a sudden sense of fear that peaks really quickly. This can be repeated, unanticipated, or it can be triggered. Next, we have phobia related disorders. A phobia is a fear, and there are many different types of phobias, including flying, heights, blood, or even social interaction. It becomes a phobia related disorder when the person takes active steps to avoid or experience it, and when they are forced to endure it, they have a high amount of anxiety. So, who's at risk for anxiety? Actually, there are genetic and environmental factors that go into somebody's risk. There are genetic factors such that history of relatives or family members, and there are environmental factors which could be trauma or if you were exposed to a stressful time or event as a child. How is anxiety typically treated? Well, there are medications which are not a cure for anxiety but can alleviate symptoms. The most common medications that are used are anti anxiety medication, antidepressants, or beta blockers. But medications do have drawbacks, including to tolerance. Other than medication, one other way that anxiety is treated is cognitive behavioral therapy. A chart that explains cognitive behavioral therapy can be seen in the top left corner. Basically, what cognitive behavioral therapy, otherwise known as CBT, believes is that you have to teach people different ways to behave and respond to events that trigger their anxiety. This map shows that your thoughts encourage the way that you behave and feel, and your feelings affect your behavior and your thoughts. And lastly, your behavior affects how you feel and think. They're all interrelated, so CBT focuses on how that they can affect each other, and you can benefit the effects of anxiety by focusing on one at a time. So, where does exercise come in? We've all learned throughout this course the overall benefits of exercise, which include reducing fatigue, improving alertness, increasing quality of life, increasing self esteem, decreasing mortality, and decreasing the risk of cardiovascular disease. Well, actually, the effects of anxiety on someone's life have been proven to decrease their quality of life increase mortality, and increase the risk of cardiovascular disease. So, since the exact benefits of exercise contradict these effects of anxiety, it is clear that exercise could be a possible treatment for anxiety. So, what does the research say? I looked into many different articles about the effects of exercise on anxiety using PubMed, and I found that in a meta analysis of 5 different studies, 4 out of 5 says there are a decrease in symptoms of anxiety, with effects ranging from small to moderate. So, this clearly tells us that exercise might be an effective way to treat anxiety. Also, it said that exercise was proven to be as effective as medication in some instances, but it was never proven to be better. In the second study that I looked into, another meta analysis of 9 different studies, they found that aerobic exercise is moderately effective at reducing anxiety. However, they did find that higher intensity exercise is much more effective at reducing anxiety than low intensity exercise. This is great news for prescribing exercise to reduce anxiety because the different intensities have different effects. So, overall, it has been proven that exercise can have a beneficial effect on those that have anxiety. And I don't know about you, but whenever I'm having a stressful week at school or I'm feeling a little anxious, I head to the gym and I do the sweatiest, hardest, most intense session I can because it helps me get my anger and my stress out. So, even if this research does not correlate into the clinical aspect, it could be beneficial just to know the effects that exercise does have on anxiety, and it could be used for you and for your occasional anxiety, even though it has also been proven in diagnosed anxiety. So, what is depression? Depression is a mood disorder, and it causes severe symptoms that affect how you feel, think, and behave. Typically, the symptoms have to be present for over 2 weeks to be considered clinical depression. Similar to anxiety, there are many different subcategories of depression, but today we'll just look at a few of them. There is persistent depressive disorder, which is a depressed mood that lasts for at least 2 years. Postpartum depression, which is a feeling of sadness, anxiety, fatigue that accompanies any postpartum depression. It makes it difficult for new mothers to complete daily care activities for themselves and even sometimes their babies. Also, there is seasonal affective disorder. Seasonal affective disorder is the onset of depression during winter months, and it can actually be accompanied by social withdrawal, increased sleep, and weight gain. Who is at risk for depression? Family history has a major cause of if you have a risk for depression. But similar to anxiety, there are also environmental effects, such as a major trauma or a physical illness, or even medications that someone has taken. So, how is depression treated? Currently, depression is treated with medications, usually antidepressants or psychotherapies, which just includes talk therapies or counseling, interpersonal therapy, otherwise known as IPT, and actually, it's also treated with cognitive behavioral therapy, which is also, if you remember earlier, one of the treatments for anxiety. And then another treatment that is usually used if medication or psychotherapies are not working is brain stimulation therapies. So our question comes to, what about exercise? So what does the research say? The research says that exercise has a moderate to large benefit on those that are clinically diagnosed with depression. However, the research does not support exercise as a treatment for those that are not clinically diagnosed. The optimal intensity for exercise is moderate to vigorous. Additionally, exercise can be just as effective as an antidepressant, but it wasn't shown to be more effective. Lastly, if they are used in conjunction, they still have a moderate effect. Overall, it was found that exercise decreases the symptoms of depression. And although we have other treatments such as medications, psychotherapies, and brain stimulation therapies, it should be noted that exercise has a profound effect on depression, and it's even compatible with medication, which is substantial. So, although that they are similar, it should be known that exercise has a lot more benefits than medication because medication can come with withdrawal or reliancy or even tolerance. So I feel like if given the choice between exercise and medication and knowing that one would be more beneficial or equally beneficial, you should probably choose exercise because it's better for your health. So now I would like to compare and contrast the findings of the effect of exercise on depression and anxiety. It was found that exercise had effects on anxiety and depression and actually decreased the symptoms of both of them. It was found that the effects of exercise on depression were more significant. However, there still were effects of exercise on anxiety, and it could be just because there's not as much research done on the effects on anxiety as there are on depression. It is also notable that the effects on the intensity of the exercise matters. So, actually, for both anxiety and depression, the more intense the exercise, the more profound the results. So, for anxiety, it was found that moderate to vigorous intensity exercises were more beneficial than just an aerobic one. And actually, the same was found with depression. So, it's really interesting to find that out, and I hope that there is more research done into that. So here's a list of my citations. I went through a variety of meta-analyses of the effects of exercise on depression alone, anxiety alone, on both of them together. And then I also did some research on the illnesses themselves. I used PubMed for most of my articles, and then I used government resources to find information on both depression and anxiety. Thank you guys so much for listening, and I hope that you learned something about the effects of exercise on anxiety and depression.